quite a big cocktail going on there. So I think really when we're talking about anxiety, we must first understand stress, because stress and anxiety are actually linked. So I always explain it like this, Louise. We have stressors as the things that stress us out, and stress is the physiological and psychological response to those stressors. So stressors can be psychological or physical. So it could be something like an internal thought or an external event, and will be somewhat independent upon each person's perception. So an example, Louise, would be getting on a crowded train after a pandemic, or just the thought of getting on a crowded train after a pandemic. But when anxiety is expressed, it happens really in three ways. The physical symptoms we have, which will be heart rate going, tension, we might be cold or sweaty or have nausea. There could be the psychological symptoms of that, which is the worry, the rumination, difficulty concentrating, racing thoughts, for example, and the behavioral part of that, which is kind of the inhibition, maybe avoiding different situations. So when we have this response in our nervous system, this activating agent happens, say something comes into our environment we don't like, we have a thought we don't like, we set off what's called our sympathetic nervous system, which I know is sort of ironic because it doesn't feel very sympathetic at the time if we're struggling with anxiety. But what happens is there will be a release, a chemical cocktail, which will set off this alarm system in the body. But what we have to remember is this system is really based on a generic system used to mobilize other systems in the body, right? So when we have this chemical cocktail release, some parts of our body will get a yes signal, go, like heart rate, blood flow to our muscles to get us to go and do something. And some parts of our body will get a no signal, like salivary glands, digestion, reproduction get a no signal, right? So we'll have all these things happen. And also actually our pupils will dilate. We're in this sort of alert response. So our field of vision will actually narrow down because our visual system is connected to these fight or flight systems within our body. But what we have to remember, we have all of this alarm signal going off in the body, but we could have this same alarm signal going off, this same stress signal when we're exercising heavily, when we're doing something incredibly exciting. Because if we have a real or perceived threat attached to it, then we're going to perceive that physiological response very differently. And I think, Louise, it's fair to say, and anyone on the call can probably relate to this, much of what we encounter today are psychological threats. So we don't have to, they're not called for the same physical action. I think, Louise, also it's important to say that about 30 to 40% of people will experience anxiety sort of almost passed down as a family trait. But this is really to explain how some people experience chronic stress, whereas other people, maybe they'll get backache, maybe they will break out in a certain skin condition. So I think it's just important to know that that's how it's happening in our body. This alarm signal is going off. We're misusing our imagination. There'll be catastrophic imaginings and a sense of dread, which of course doesn't help enable people to operate at their best.